What's up, brothers?
I'm Whitney.
I'm McKenna.
And this is the Communication Corner. Today we're going to be talking about the National Patient Safety Goals and how we can improve staff communication.
Yep, so like Whitney said, this is not something that we're just making up and decided was important. The National Patient Safety Goals are national standards that are set to help reduce and eliminate, if possible, preventable medical errors. And communication, obviously, we're human, we're imperfect, we can't communicate well all the time. And so we're going to go over some different types of therapeutic communication and some types of communication that are not as ideal that could potentially lead to medical errors.
Perfect. Well, we'll get into it.
So, Whitney, back when we were in nursing school, we took those awful ATI tests, and I remember that there was one category that was weighted a lot more than all the other ones, and I feel like we always had to do like the full 6 hours of remediation for it.
Yeah.
Because there was always something that we can improve on it.
Was it patient safety, maybe?
Yes, I think it was.
Okay, perfect. So, with patient safety, we have continuity of care. So this requires continuous communication. This is continuous communication throughout with everyone. So patient, healthcare provider, doctor, everyone. Multiple communication. Where are you doing? Where you're at.
Beautiful. And this next one is actually one that was a National Patient Safety Goal specific goal. So critical lab value reporting, making sure that the right test is done on the right patient and that those results are communicated to the right person in a timely manner. So we want to make sure that when a patient gets something done, that we're actually getting those results to the doctor, whoever needs to report them, so the patient is aware of what's going on and we can start implementing the correct interventions.
Yeah, so then that goes into medication error. So we do have medication errors. Doctors write wrong medications, nurses can make medication errors. Everybody's not perfect, so it's important that we do our jobs and our checks as nurses to do our checks to make sure that they're not making mistakes. And if they are, that we're catching them and we're following up with the doctor. It is very important that we follow up with the doctor so that way they can correct it or figure out what's the miscommunication is.
And then lastly, probably the biggest part for safety is education. As nurses, we provide a ton of education. It's probably one of our number one jobs. And so with safety specifically, we're taking care of these people that are not themselves. They're not at 100% yet. They aren't always aware of what their capabilities are and what their limitations are as they are recovering. So it's up to us to make sure that we are educating them, especially to what they're capable of right now. We need to advocate for them, not only to people around us, but also to the patient themselves, to make sure that they are aware of what they can do, what they can't do, and that we are then following up to make sure that we're helping with that education afterwards.
Yeah. So we want to evaluate, educate, and follow up, like McKenna said. We don't just want to educate our patient and then turn them loose into the world and be like, good luck. No, we want to make sure that they know what they're doing and that they can do these things properly, like teach back method, certain ways. But we want to make sure we're just evaluating and educating in a way that they understand and just following up.
Yeah. And so we actually have an example, I think, from one of our friends that they submitted that they wanted us to take a look at and see if they were using the correct communication pathways. Okay, so it is time for our therapeutic communicator safety moment.
Okay, so this nurse, she had an experience where she thought she taught the patient how to administer insulin, and turns out when she went to chart, the patient did not know because he stabbed himself in the finger. So her question is, am I a therapeutic communicator because I did tell him how to do it? I don't know. Is just telling enough?
I don't think so. Because we said that we needed to evaluate, educate, and follow up. And if he's having problems with his glucose levels, then he's probably having some level of disorientation with his cognitive function. And so we know that we need to educate, and you know?
Yeah, this nurse, she could have taught back the method to make sure that this doesn't happen. That would have been
True. If this was his first time, we should have watched him do it first, probably.
Yeah.
Maybe. Next up, please do not zone out when I say what I'm about to say because I know it's everyone's favorite topic. Clinical judgment. That is right. We are taking it back to our first semester of nursing school. We are going to be going over the nursing process, which has this super fun acronym, ADPI, which you probably remember since it's been ingrained into our brains. So first up, we're going to be going over the assessment and how communication plays into that. So it's important that we establish those relationships with our patients that are based on therapeutic communication and based on trust, because if we don't, then we aren't going to be able to get the evidence that we need when we're forming their care plans.
Yeah, that's right. So next up we have diagnosis. So we want to be straightforward about diagnosis. We don't want to just kind of sugarcoat anything. We want to be pretty straightforward about it just because sometimes you need to hear the words for them to be real.
Okay, that's true. I mean, I'd probably be delusional and try to avoid it if I
denial.
Yeah. Next up we have our planning. So planning is always centered around the patient. It does not matter what I want for Whitney if Whitney doesn't want that for herself. So we got to make sure that our plan is what the patient wants, or else they're not going to give it their full effort. So when we're doing this, we want to make sure that we're involving every aspect of the interprofessional or interdisciplinary team. If we don't get to know our coworkers and don't get to know our own strengths and weaknesses, especially as new grad nurses, as baby nurses, then we're not going to know when to ask for help, what we need to even be asking, or any of those super, super important things.
Yeah, that's right. So next we have implementation. So we want to educate our patients. We want to educate them thoroughly on all of our interventions and encourage them to give us updates, keep us in the loop, let us know what's going on, because this is going to help us do more evidence-based teaching, and this is going to help with their health promotion, because we want to encourage them to keep their health up, and if we don't know what they're doing at home, we don't know what they need taught on or what they don't need taught on. So it's just really important to help manage their health, to cover these aspects, and just because we're all about health promotion.
Yeah. It's almost like we just finished our first semester or something.
Crazy.
Okay, and lastly, we have our evaluation. And so the evaluation is crucial to the nursing process, because if we aren't evaluating,
how do we know if it works?
Yeah, do we even do anything? I don't know. And so when we're evaluating, we are facilitating that honest and open communication, because patients may not want to be honest with themselves about where they're at. They may be nervous about going home. They may not want to be in the hospital at all. But I don't know about you, but if I have a 98-year-old granny that needs a walker or a wheelchair and is very adamant that she can go home independently without any help with like a broken hip,
I don't know. I don't know about that.
So we
some reevaluating.
Yeah, we're probably going to need to make sure that the patient's being honest with themselves, because we're not only advocating to our patients when we're communicating with the rest of our team, but we're also advocating for our patient to the patient, because it's hard when you're sick and you just want to be home in your bed. You don't want to be stuck in the hospital, so we got to help them along with that.
Yeah.
I want to go over with our handy little presentation here on our podcast is communication in the clinical sites that we have been working in this semester. We chose to use Powell Valley Healthcare because we feel like we've seen some really cool things that have allowed them to implement these national patient safety goals directly into their patient care, and it affects both the patient relationships as well as with coworkers and with people in the facility as a whole.
Yeah, so they actually have a unit practice council, and this council has a neat little board, as you can see here, and they have phrases, just kind of some team building exercises that really help them grow as a team, because that's what really makes communication easier among team members if you get along. So one of the quotes that they have and that they are suggesting, and also that we're suggesting, because it's a great quote, is be the kind of coworker that you want to work with. I don't want to work with somebody who's going to be awful to me, so I'm not going to treat others the way I don't want to be treated. So we're going to be nice to people. One of their big things is we're going to advocate for change in community to improve the unit for our patients and our coworkers. So we want it to be a healthy environment. We want to have good policy work, improve workflows. We want to have good education, patient satisfaction, and team building exercises.
Perfect.
So these are some policies that Powell Valley Healthcare has actually implemented in their facility that they use on a daily basis. There is the critical lab values, which again goes on our national patient safety goal. This is a big one. They have translators, and then the nursing reports, handoff reports. Very important things. We need to have good reports so we have all the information.
Okay, I have an 87-year-old male for you, Mr. Jones. He presented to
Is his wife here?
She is at bedside. He presented to the ED last night with shortness of breath. He was diagnosed with pneumonia.
Did they get an x-ray on that?
Yes, they did do an x-ray in the ED last night. He's currently in his chair. We just finished his
breathing
treatment. Does he have an IV? He has a 20 gauge in his right AC.
His right AC?
Yeah, EMS did it.
EMS did it.
I actually don't think you need this report. go ahead and comment the red flags of communication down below.
Like and subscribe.